All right, Dr. Jordan, we've got a few questions from some of your last videos. You ready?
I'm ready.
Okay. Hi, everyone. I'm Dr. Joyce Knieff. I'm a naturopathic doctor, and
I'm Dr. Jordan Knieff. I'm also a naturopathic doctor.
Okay, so we have a question here. I have a friend with little working options. He has diabetes and works outside in Arizona. Does triple degree weather have any interaction with diabetes beyond normal things like heat stroke and dehydration?
Yeah, I mean, the dehydration is probably a big piece, and I think one of the hidden kind of factors that might be in there is electrolyte balance. So when we think about dehydration, it's not just always about water, it's also about sodium, potassium, and magnesium.
Yeah.
And those are all important for so many things in the body, but magnesium especially is really important in metabolic processes and blood sugar control.
Oh, yeah.
So we see it pretty often that if people supplement magnesium, their blood sugar control improves to some degree, depending on how deficient they are. And so this person is outside sweating in triple degree weather all the time. Right, all the electrolytes get lost through sweat. Again, about like sodium and sometimes potassium, but we really are losing all of them. And if they're sweating a lot all the time and not replacing those, then that could be pretty significant, especially because magnesium is already pretty deficient in people's diets. So I'd say that'd be the first kind of piece there.
Yeah, and I can also think of because magnesium in particular is required for a process called beta oxidation. Beta oxidation is the process by which your body needs to run its fat stores through in order to use up any of your fat. And from my perspective, I'm seeing being out in high heat as sort of, it's kind of like a calorie intensive process, right? Mm-hmm. So you are using a lot of stores up, and specifically, I know this is probably about type 2 diabetes, but if you had type 1 diabetes and you were out in triple degree weather for that long, and you did not have enough cofactors to engage in beta oxidation and use fat stores, you could run the risk of having your blood sugar tank, actually. So that might be something to be careful about.
Yeah. Mm-hmm. Yeah, and other things I think is to consider is what type of job are they doing?
Right. Is it
outside in Arizona in triple degree weather? Mm-hmm. And if they're doing something like construction, then there's always the exposure risk to kind of consider. Are they using the proper PPE? Are they inhaling all of those dusts and things like that can really impact the blood sugar control just from a exposure standpoint?
Like an inflammation standpoint, yeah.
And things like, what are they eating for lunch? Are they having fresh foods? Is it harder to eat fresh foods because they have to have their lunch with them out in triple degree weather, so they rely more on convenient foods or packaged things, stuff like that. So right, again, kind of always circling back to that nutritional piece for diabetes, but kind of more to their point with the heat itself, right? I mean, high heat is a stressor,
right? And
so sweating for that long is stressful for more than a few other things. It's good for detox, actually, so that it could be a point in their favor. But again, depending on what they're doing, how active they are, and how active they're able to be outside of work, because if their work is kind of that intensive and stressful on the body, then I know I would probably go home and shower and sit on the couch, so I can probably extrapolate that they're likely to do something similar. And so again, kind of always working towards the not just total time spent exercising, but also breaking up sedentary time.
Got it, balancing up those two aspects there.
And so even if they go home and really want to rest, rest is important.
Yes.
Eat dinner and then, go for a light, non-intensive walk, but just to break up that intensity, de-stress a little bit. Light movement like walking really actually helps sleep quality, and sleeping well also is a really important thing for overall health, but especially diabetes and blood sugar regulation.
Right. And I could also think of if you I think it's a normal human situation if you were out in triple degree weather to kind of lose your appetite. So maybe examining the choices around food that happens when you don't have much of an appetite, etc.
Yeah, because a lot of people reach for the kind of easy snack foods that unfortunately
Yeah.
have a lot of
Not
other
saying that this person is, we're just
Yeah.
like
In general,
just
in general.
it tends to be a tendency.
Yeah, easy carbs, quick things, and like salty snacks and stuff, which again is like probably a good thing overall to get those electrolytes in, but you need to kind of think about that source and how it balances with the rest of
Right.
it.
Are you getting enough fiber? Are you getting enough other minerals? That sort of thing. Okay. Well, we also have another question here. Are there any other exercises that work if someone has a desk job?
Yeah, I mean, having a desk job doesn't exclude people from any exercise.
That's true.
So it's usually about just building the habit, encouraging them that they can do those other exercises, and kind of working up to it gradually. And so I admittedly don't remember exactly which ones I talked about in that last video, but for people with a desk job, usually where I start with recommendations is to set a timer to go off every 30 to 60 minutes or so, kind of depending on what their work really allows for them to do, right? And every time that alarm goes off, take kind of 2 to 5 minutes to just stand up, walk around, get some movement. Again, it doesn't have to be exercise specifically, you just want to break up that sedentary time. But if someone is really working towards, like managing diabetes or just gaining strength kind of quicker, then they can use that time to do like squats or push-ups or kind of other like relatively simple kind of low barrier whole body exercises. I had one patient who was diagnosed with diabetes and it scared the crap out of him. And so every time he had a break, he would run up and down the stairs.
Oh my gosh.
In his building for 20 minutes.
Wow.
Which is very intensive, right? And so a lesser intensive version of that would just be to walk up and down the stairs, right? Even if they're just doing a few flights, if they're doing that a few times a day during those little breaks, then that adds up pretty quickly, right? Builds up the strength in their legs, starts building up their cardio, and encourages their body to work on the lung capacity and oxygen capacity, mitochondrial function and density and things like that.
Right, especially using those like big muscles, the glutes and the quads. Yeah, I've also heard about trying to get like 100 maybe micro squats in the day, and micro squats being getting up from your chair and sitting back down on your chair, like just butt tapping your chair.
Yeah, and so that kind of gets to the second conversation we usually have with patients who are relatively sedentary starting out, which is exercise modification.
Right.
So, like you said, the chair to standing squats, right, are usually a lot easier for people.
Yeah.
They feel safer as when they're coming down to a squat, the chair's right there. So if they fall, all that happens is
they sit down on the chair. Yes.
But it starts building that confidence, especially if they are really intentional. Okay, I'm going to do 20 of these at a time, something like that. And then as they get stronger and get more confident, then they can either find a lower chair or start doing the squats without the chair, trying to get down to
like the full
range of motion over time. And the one I usually get really big pushback from is push-ups. I tell people to do push-ups and they look at me like a deer in the headlights and say, I've never been able to do a push-up, or I haven't done push-ups in 30 years. There's no way I would go down on the floor and I would be able to get back up. Which again is fine, it's fair, it's where people are at, and the whole point of the medicine we do, right, is meeting people where they're at. And so I am not a fan of knee push-ups. So it's a really common modification where people are told to go down on their knees and hands and then do a push-up that way. It's hard on the knees. It changes the nature of the push-up from a push-up to more of a kind of like a hinge swing on the shoulders. Not that that's necessarily a bad exercise, but it's not really what we're going for most of the time. And so I just tell patients to do what's called an incline push-up. So that's finding a wall, a windowsill, a table, kind of wherever they're at, and doing a kind of proper form push-up, just add an incline. And so starting out, even if they are completely parallel to the wall, right, they're doing push-ups, and there's essentially no resistance there, right? But it builds confidence, it teaches those muscles and the range of motion and the cooperation that we're looking for. So it trains the nervous system to actually do that exercise better. And over time they can just find something that's lower and lower, so they can step further away from the wall, Yeah, they can find a windowsill, a desk, a table, a chair, whatever,
Yeah.
and just
Make sure it's stable.
make sure it's
Make sure
stable.
it's stable.
And over time, they just slowly increase
The incline.
that incline until they can actually get down to the floor and do push-ups.
Got it. So building strength like over a long period of time.
Over a long period of time, a lot of people are fixated on the end goal, which is important. Like, we do want to build that strength and get to a place where they're actually really strong, right? Because
Yeah.
again, not just about like managing a specific diagnosis like diabetes or other metabolic things, but overall wellness and graceful aging, right? And you know that the stronger people are as they get older, then the less likely they are to get injured, to fall, the longer they can live independently, right? Things like that maybe people in their 30s and 40s aren't really thinking about,
Yeah.
but they'll appreciate once they start hitting 70, 80, and those things really matter to them.
Okay. So I think that was a pretty good answer to those questions. If you guys have any more questions on that, drop it in the comments and we'll make a video about it.
Yeah.
Make this guy answer. All right. Thanks, guys.